Hey, all, you are listening to the Real Life Pharmacology podcast, and thanks so much for tuning in. Today I'm going to cover tetracycline antibiotics. I would say, in comparison to something like a penicillin antibiotic, like amoxicillin, tetracycline antibiotics are probably used a little less frequently than that. However, doxycycline of the tetracyclines is probably the one I see most. So some examples: doxycycline, brand name Vibromycin; tetracycline, minocycline, brand name Minocin; and demeclacycline is another tetracycline antibiotic, which kind of has a unique potential use that I'll cover here. Mechanistically, how do these drugs work? Well, in their antibiotic activity, they bind to the 30S ribosomal subunit. And ultimately, what that binding does is it inhibits the bacteria from producing necessary proteins for them to continue living as well as proliferating. So 30S ribosomal subunit is where these drugs primarily bind and the activity that they work on. Fantastic test question I've definitely come across in my career in pharmacology. Now, with the mechanism and helping to obviously kill bacteria, treat infections, there are certain infections that these drugs tend to treat or have more activity against. And one that I classically see in my area is Lyme's disease, and doxycycline is the drug of choice for that infection there. Other conditions, disease states, you might see doxycycline used as an alternative in pneumonia, for example. You may see it used for other skin and soft tissue infections. I also remember kind of throughout school, doxycycline kind of being an alternative for lots of different unique infections that don't happen very often. So lots of uses, potential uses for doxycycline, but very few, I would say, that it's generally the first line agent you would pick. So especially in the more common infections. So kind of take that with a grain of salt there. Now, doxycycline, that's kind of the one I'm focused on most, does have MRSA. And for those of you that might not remember, MRSA is methicillin-resistant Staph aureus. It's kind of a bug that is resistant to a lot of different antibiotics, which can be troublesome to obviously treat. Doxycycline is an oral option that does have activity. Obviously, we've got IV medications like vancomycin, linezolid, which is also oral. But with that, the doxycycline can help manage a potential outpatient MRSA type situation. Let's get into side effects of these medications. And as far as side effects go, with most antibiotics, you can probably lump them all together, where there's highest incidence is going to be GI upset, things of that nature, nausea, potentially vomiting, potentially diarrhea. That pretty much goes with most antibiotics. There is potential for rash and skin issues as well. That's going to be a little less likely than some of the GI stuff. But we've also got this potential for photosensitivity. So that's an increase in the risk of sunburn. So depending upon the time of year, depending upon the area you practice and work in, that photosensitivity risk of sunburn may or may not be as relevant to you. Now, one really important thing that I've definitely seen come up on in pharmacology exams and board exams is the issue with using tetracycline antibiotics in pediatrics. Now, these drugs are not, in general, supposed to be used in pregnant females and in kids. So keep that in mind when we're considering these drugs. And the reason they're not supposed to be used is they can cause some tooth discoloration, or at least that's kind of the most classically well-known symptoms, and really cause some permanent discoloration, damage to the teeth when using these medications. So definitely a big concern, and definitely something that you really want to watch out closely for females, maybe particularly of childbearing age. I'm going to finish up on drug interactions, but I wanted to make you aware, definitely help support the podcast and me continuing to do this. MedEd101.com/free book. If you are not an Audible subscriber, you can absolutely get this book for free. It's a really cool process. You don't have to stay if you don't want to. You don't have to continue to pay membership, but they do give you the first book free. So it's a pretty cool thing that they let you try out. And I know the power of audio. I love podcasts, and I'm continually learning a lot through audio because it does get challenging to find time sometimes sitting down and reading a book, for example. So meded101.com/free book. You might as well go give it a shot. You can get the book absolutely for free. See if you like Audible. And obviously, if you do, you can continue to pay the membership. But the first one is absolutely free, and you can cancel if you don't want to pay any amount after that. So definitely go check that out. Getting back to the tetracycline antibiotics, the biggest drug interaction that I think you need to be aware of that can have clinical impacts are these binding interactions. And that's often because of cations. So things like calcium, things like iron, antacids, these all can bind up the tetracycline derivative. And with that, if we bind it up in the gut, the drug is not absorbed. And if the drug isn't absorbed and getting into systemic circulation, we're not going to be treating the infection as adequately as we would like. So ultimately, these binding interactions lead to reduced concentrations of the drug in the bloodstream and ultimately put our patients at risk for treatment failure and worsening infections. So that's really the biggest interactions I see with this class of medications. I will also throw out there warfarin. These drugs can interact, alter warfarin concentrations, and ultimately raise INR, so could increase the bleed risk there. So that's another one that I definitely keep an eye on. But with warfarin in general, anytime a new drug is started, I definitely take a peek and pay attention and make sure that we're not causing a significant drug interaction that could lead to supertherapeutic or subtherapeutic dosing of that warfarin and an out-of-range INR. So I think that wraps it up for today. reallifepharmacology.com. I've got that free PDF giveaway as well. If you want to subscribe to the site, go ahead and check that out. Top 200 drugs, where I lay out 3 very important clinical pearls, highly testable clinical pearls that you may see in your pharmacology class and or board exam. So feel free to sign up, go check that out, and I also alert you when I've got a new podcast available for you as well. So going to sign off for today. Thanks for listening. Take care and have a great rest of your day.